My name is Sister Mary Kilgariff. I'm a member of the Sisters of Mercy, formerly of the Burlingame region, now of the West Midwest community. But the community that I joined was the community that founded St. Mary's Medical Center back in 1857. And the history of St. Mary's really kind of entwined, or is entwined, with the history of San Francisco. Founded in 1857 by the Sisters of Mercy, who arrived actually 2 years prior to that date in 1854 at the request of Archbishop Alemany, San Francisco's very first archbishop. And Archbishop Alemany arrived in San Francisco shortly after the discovery of gold. And that prompted San Francisco to become a very unruly city for those who had come from worldwide, by land and by sea, to seek instant riches. Gold, as you know, was founded up in the Sierra Madre Mountains in 1848. And so approximately 50,000 people a month after the discovery of gold came into San Francisco and used it as a stopover city so that they could regroup and make it up to the Sierra Madre Mountains, where they could find their instant riches. Those who did not find instant riches came back to San Francisco, and that added to the upheaval of the city. There was actually a body of leaders in San Francisco, a board of directors, if you will, but really the law and order of San Francisco at that time was primarily in the hands of various vigilante groups. And so when the sisters arrived in 1854, they were not met with a great amount of enthusiasm. In fact, the leader of one of the vigilante groups actually tried to run them out of the city. But in any case, Archbishop Alemany asked the sisters if they would simply visit the patients in the State Marine Hospital, which would have been considered San Francisco's first county hospital. And so they purchased a little cottage across the street from that hospital on Stockton Street at Broadway. And they continued to make their daily rounds across the street to visit the patients, to be with them in their dying process. Now, there were physicians in San Francisco. There were outstanding physicians in San Francisco. However, the primary care of patients was done in people's homes. About the time of the discovery of gold, there was about 35,000 people living in San Francisco. And as you know, San Francisco is a peninsula surrounded by water on all three sides. And the terrain was pretty much pockmarked by various farms, dairy farms, cattle farms, herbal farms, yerba buena, the good herb. And so when gold was discovered, with all the people coming into San Francisco, there was tremendous upheaval. And although there was one hospital, any doctor of good reputation would not admit a patient to the Marine State Hospital. You went there to die. Soon after the sisters began making rounds and visiting the patients, they began to also see what changes needed to be made. They had great experience from their time in Ireland. At the time that the order was founded by Catherine Macaulay in 1831, Ireland was just coming out of the effects of the penal code imposed on them by the British government. And so there was much destitution in Ireland, and especially in the city of Dublin, where young people, young men and women, would flock to the cities to see if they could get any type of a job. And Catherine Macaulay, the founders of the Sisters of Mercy, was actually born into an aristocratic family, and she was left a rather handsome inheritance by her relatives. And she used that money to go to the wealthiest part of Dublin and to put up a building, the first Sister of Mercy house, which was for the protection, the shelter, the education and training of young women, so many of whom were abandoned on the streets of Ireland. So the sisters had great experience in working in times of devastation, and that's what they met when they came to San Francisco. Soon after they began to make changes in the care, the quality of care that was provided to these dying patients, doctors began to rally around. And within 2 years of their arrival, receiving no monetary reimbursement from the city or the state, the sisters were able to garner enough funds to purchase the hospital. The city of San Francisco was in the process of building a new county hospital. And so they basically walked away from this original Marine State Hospital, and the sisters purchased it and put up the very first sign, St. Mary's Hospital, on July 27th, 1857. There were a number of doctors in the city who continued to make up the staff of that hospital. Dr. Beverly Cole, who was on that very first staff of the original St. Mary's, went on to found the University of California College of Medicine and the American Medical Association. Dr. Levy Cooper Lane, another physician on staff, went off to found the Stanford School of Medicine. Throughout the years, St. Mary's has been blessed by a number of outstanding physicians, and to this day we continue to see the medical practices that are provided through St. Mary's by these wonderful young physicians now. The hospital on Stockton at Broadway continued to function for the next 5 years. And then when the needs of the city outgrew the size of that hospital, there was land purchased at the base of what is now the Bay Bridge at First and Bryant. And so in 1861, the second St. Mary's Hospital opened its doors, and it was touted as the state-of-the-art hospital. It had an elevator lift, it had private rooms for $15 a week, it had double rooms for maybe $12 a week. If you brought your own orderly or aide, the price was knocked down further, and if you brought your own liquor, the price was knocked down even further. Many patients came to that St. Mary's Hospital, and in fact, in keeping with tradition of the Sisters of Mercy, the hospital had a ward for homeless men, elderly men. It had a ward for homeless elderly women, and it continued to have housing and shelter for young women where they could, again, be trained, educated, so that they could go off on their own and earn a livelihood. Catherine Macaulay felt that the greatest work that a religious order could do would be the education of young women, because once a young woman is educated, then she will go off and raise her family and be able to contribute mightily to society. And so that has always been a thread that has followed through all of the works, even our healthcare works. The St. Mary's Hospital, the second one, which began in 1861, then functioned until 1906. And we all know what happened in 1906. The big earthquake struck San Francisco. And as with much of the city that was destroyed, St. Mary's Hospital was destroyed. However, not a single patient or staff member died as a result of the earthquake. The patients were taken by lift down to the ferry boat and then brought over to Providence Hospital in Oakland. And that hospital had started just a short time prior to the 1906 earthquake.